Really, Dr. Satwik, we heard that man saying he's never seen this in his life. This is something none of us have seen in our lives. But tell us, for a doctor, what is it like going through this right now in what's become the world's COVID capital, and what's happening in Delhi replicated in so many other cities?
I think these scenes of suffering are absolutely disturbing, and it's dreadful that because of data suppression and data fudging, particularly in some states, you have a situation where wood used for pyres, funereal pyres, is serving as the proxy and surrogate for the number of deaths. It's completely unfortunate.
What is it like? Because I think, Dr. Satwik, another crisis which is being underreported is what's happening currently in our hospitals, because we've heard of doctors, nurses falling unwell, doctors and nurses being the target of anger of patients who don't know what to do when they're not getting beds or oxygen supplies. So in that sense, if you're going to see this situation continue for, say, 2 weeks, how is our health infrastructure and all of you actually holding up?
Well, all hospitals are working at augmented capacity. Our emergency rooms are full. There's scarcely a place to keep a stretcher. All the oxygen points are taken. It's heartbreaking when doctors in emergency rooms have to refuse patients. So as someone had pointed out, the sick can't get into hospitals, the dead can't get into crematoria. It's absolutely horrific. But what I'd like to say is that I think this is also the time to kind of rationalize our resources, because what's happening is that a lot of these cases of moderate COVID who then progress to severe COVID need constant investigations. And for want of investigations, for want of resources in laboratories, kits are running out. They can't get their blood tests done. The turnaround time for investigations is turning out to be 3 or 4 days. So patients who are having a deterioration and a decline in their condition can't get to hospitals in time. So I think it's about time that all doctors should also start rationalizing and not indiscriminately prescribing blood tests for every COVID patient, because what ends up happening is that even you have a mild case of COVID, it's entirely possible that your physician might prescribe a whole set of tests, and that just adds up to the system and clogs it completely.
Absolutely. And Dr. Satwik, again, we're talking about Delhi, which is probably the best equipped city in India as regards medical infrastructure. That's the situation. So we can't imagine, or we know actually what our reporters are telling us about what's happening in UP, Bihar, many other states with medical resources. But what is the key area to focus on now? We've seen focus on oxygen supply for the last, say, 2 or 3 days. We're seeing some movement there. But the issue of creating more ICU beds, ventilator beds, and also finding personnel to actually man or woman them. What's the big focus that we all need to work together on right now?
Look, I think capacity is being augmented by the central government and the state government. And I'm sure they're doing all the right things, and it's beyond my pay grade to speak on that. But I think this is the time for all of us to completely double down on non-pharmacological interventions. What's happening is that these variants which are driving the surge currently are extremely transmissible. So household infections are really, really raging. So if you've got one person who's positive in a family, everybody ends up getting, turning positive. So you have to concentrate on non-pharmacological interventions. And I think a certain amount of education and literacy in terms of dynamics of transmission is very essential, particularly in terms of visual communication and messaging about how this virus is airborne and can stay in unventilated spaces for a long time. So how should primary caretakers in households protect themselves? Because if everybody falls sick, nobody ends up getting any care. So I think a lot of attention should be focused on messaging and communication for stopping dynamics of transmission, because this virus can only move from a human to human. So if you physically block transmission, you can achieve a lot. And this is the time to double down on that sort of messaging, particularly for affected households.
Absolutely, because we're seeing lockdowns, but you're right, family areas are still an area which is potentially very, very infectious because you are without masks there, despite what Dr. Paul said. But finally, I mean, as a doctor, as an Indian, in a way, we still don't seem to realize the magnitude of what we're actually going through. I mean, this is India's worst ever health crisis. But for instance, as I speak, in Delhi tonight, there's an IPL match going on, which will have ambulances and medical staff on. As I speak, there'll be a by-election happening somewhere in India, or a panchayat election, or counting results. We seem to be in so many different parallel planets. Would you like, as a doctor, as an Indian, what would you say today?
Well, I think, look, our disastrous unpreparedness has been exposed, and that's something we must consider. And you know, you're at a point where you have to concentrate on judicious allocation of scarce resources. So whatever resources you have, they have to be rationalized, and you can't afford to kind of squander manpower and other things. But also, it's very important not to suppress data at this point, particularly because it's important in planning. There might be a third wave, and if there's data suppression, it affects planning because you don't know about resource allocation if you don't plan. You know, the super model for growth of the pandemic that was guiding the government policy in October 2020 completely failed, and therefore we were unable to prepare for this. And therefore, I think data fudging, data suppression shouldn't, you know, should never happen, so that resource allocation in the future is most optimal.
Dr. Satwik, thank you very much for joining me this evening, for setting out your perspective so crucial at this time. Thanks very much.